somebody starts out with a normal body temperature, as they exercise, especially over a long duration, their body temperature will rise gradually. And we're able to tolerate mild increases in body temperature. If you start out at a normal body temperature of 37 degrees, then you can tolerate 1 to 2 degrees Celsius increase. You get up into the 39-40 range and you start to get into trouble. Most people, if they're not pushing themselves, if they're not highly motivated, or they're not in a competitive setting, when they start to get hot, just perceptually, they're going to become uncomfortable, and many of them will stop. But it's the individual who, for whatever reason, isn't paying attention or isn't aware, or for other reasons drives themselves past some critical point, that's when they start to get into trouble. And of course, if dehydration is present along with hyperthermia, then the chances of having a medical problem are much greater. If you had a core temperature measurement, just to give you kind of an idea of what we deal with in this lab, if we're testing somebody under experimental conditions, if they reach a core temperature of 39.5, so 2.5 degrees above normal, then we have to terminate the exercise. So there are some people who at 39.5, they look like they need to stop. Others who are heat acclimated and are fairly heat tolerant and are used to pushing themselves to that point, they can manage that. But just from a kind of ethical standpoint and safety standpoint, 39.5 is a laboratory cutoff that most labs use. You may see higher temperatures than that if you go into, for example, a medical tent at a major mass participation long duration cycling event. Hotter than Hell 100 here in Texas is an example. And you might have people who come into the tent who are hotter than that, but the reason they're coming into the tent is because they have pushed themselves to some critical level.